Respiratory system. Respiratory system. The three major parts of the respiratory system all work together to carry out their task. The airways, nose, mouth, pharynx, larynx, etc. allow air to enter the body and into the lungs. The lungs work to pass oxygen into the body, removing carbon dioxide from the body. The muscle of respiration, such as the diaphragm, work to pump air into and out of the lungs during breathing. Structure of the lungs. The left and right lungs lie within their pleural sac and are only attached by their roots to the mediastinum. They are fairly free within the thoracic cavity. The right lung is always larger than the left due to the positioning of heart. In most spaces, the lungs are divided into lobes by the bronchial tree. Left lung, cranial and caudal lobes. Right lung, cranial, caudal, middle, and accessory lobes. The cranial lobe is further divided by an external fissure. The bulk of the lung consists of bronchi, blood vessels, and connective tissue. The terminal bronchiolids have alveoli scattered along their lung and are continued by alveolar ducts, alveolar sacs, and finally alveoli. Alveoli. Alveoli are minute, polygonal chambers whose diameter change with the process of inspiration and expiration and varies by spaces. The wall of the alveoli is extremely thin, consisting of two irregular layers of epithelial sheets, network of capillaries. Thus, the blood gas barrier is just a single basal lamina ideal for gases exchange. The alveolar interstitium is formed from connective tissue fiber and cells, which include collagen fibers and elastin fibers. Vasculature. The pulmonary arteries follow the bronchi, while the pulmonary veins sometimes run separately. Bronchial arteries from the aorta supply the bronchi, and bronchial veins may drain this blood to the right atrium via the azygos vein. More often, the blood from the bronchi drains directly to the left atrium. Spaces differences. The lung of the horse show almost no lobation, and the right lung of the horse lacks a middle lobe. In comparison to this, the lung of ruminants and pigs are obviously lobes. The fissures between the lobes, interlobar fissures, are deeper in the dog and cat lung compared to other species. Avian respiration has many fundamental differences to mammalian respiration. Mechanics of breathing. The main function of the lungs is gas exchange. Inspiration. During inspiration, the pressure within the pleural cavity drops to less than the pressure of the external environment. This is achieved by increasing the lung volume, brought about by the inspiratory muscles. The diaphragm contracts, causing the dome to flatten and move caudally. The external intercostal muscle contract, causing the ribs to be pulled outward cranially. Expiration. During expiration, the pressure within the pleural cavity increases to greater than that of the external environment in order to expel air from the lungs. This is achieved by decreasing the lung volume and is brought about by relaxation of inspiratory muscles. The dome of the diaphragm is pushed back by the intrathoracic pressure and the ribs back to their original position. Physiology of gas exchange. Parts of the respiratory system and organ function cannot be complete if you don't understand the transition between carbon dioxide and oxygen. Once air has been inhaled, it passes through the airways until it reaches the alveoli within the lungs. Alveolus are surrounded by capillaries through which the gases enter and exit. Carbon dioxide enters the alveolus where oxygen is extracted and passed back into the body. Principle of gaseous exchange. Gas exchange between the air within the alveoli and the pulmonary capillaries occurs by diffusion. The oxygen must first dissolve before passing through the respiratory epithelium. Gas moves from region of high partial pressure to the region of low partial pressure down a partial pressure gradient. Partial pressure is a term used to measure gases. P is the symbol used for this term. The distance between the air within the alveoli. This distance is decreased during inhalation as the lung distends. This tiny distance always extremely fast and efficient diffusion. Respiratory volumes and capacity. Respiratory volume is the term used for various volumes of air moved by or associated with the lungs at a given point in the respiratory cycle. There are four major types of respiratory volumes: tidal, residual, inspiratory reserve, and expiratory reserve. Tidal volume, TV, is the amount of air that normally enters the lungs during quiet breathing. Expiratory reserve volume, ERV, is the amount of air you can forcefully exhale past a normal tidal expiration. Inspiratory reserve volume, IRV, is produced by a deep inhalation past a tidal inspiration. This is the etc. volume that can be brought into the lung during forced inspiration. Residual volume, RV, is the air left in the lungs if you exhale as much air as possible. The residual volume makes breathing easier by preventing the alveoli from collapsing. Respiratory volume is dependent on a variety of factors, and measuring the different types of respiratory volumes can provide important clues about a person's respiratory health. Respiratory capacity is the combination of two or more selected volumes, which further describes the amount of air in the lung during a given time. Total lung capacity, TLC, is the sum of all lung volumes, TV, DRV, IRV, and RV, which represent the total amount of air a person can hold in the lungs after a forceful inhalation. Vital capacity, VC, is the amount of air a person can move into or out of his lungs, and is the sum of all of the volumes except residual volume, TV, ERV, and IRV. Inspiratory capacity, IC, is the maximum amount of air that can be inhaled past a normal tidal. Expiration is the sum of the tidal volume and inspiratory reserve volume. Respiratory rate. Breathing usually occurs without thought, although at times you can consciously control it, such as when you swim underwater, sing a song, or blow bubbles. The respiratory rate is the total number of the breaths or respiratory cycles that occurs each minute. Respiratory rate can be an important indicator of disease, as the rate may increase or decrease during an illness or in a disease condition. The respiratory rate is controlled by the respiratory center located within the medulla oblongata in the brain, which responds primarily to change in carbon dioxide, oxygen, and pH level in the blood. Thank you for your listening.